I'm the co-host of Low-Carb MD with Tro Kalasian, that New Yorker floating around here. Life's Best Medicine, where we talk about other stuff, that like what I'm talking about today. And Arizona Metabolic Health and San Diego Metabolic Health. So in GI, when we did our rotations, they said stool is cool. It's not. But it's kind of interesting, and this is something that I had to look at just looking at patients, because I'm a clinician, I'm not a researcher. So some of this may be controversial to you, or maybe like, what the heck is this guy talking about? So I'm going to try to simplify it a little bit. But the gut microbiome, has anyone heard that term before? Yeah. So the gut microbiome was all these little bugs inside us. They're actually not really inside us. Technically, the colon goes from our mouth to our anus, and everything kind of just passes through there, and we absorb what we need out of it. But they help out with all this stuff. So there's bacteria, viruses, fungi, all this kind of stuff that's actually in there. And they all kind of work like a little society, trying to keep us healthy and alive. They've been around before us, and they're going to be around way after us. And so what's the importance of it is it has to do with immune function. There's a lot to do. Sabine Hazen, some people may know her. She's an expert in the microbiome. And when she started talking, I thought, this is crazy. One of the craziest things you think about is they do stool transplants for something called Clostridium difficile, and we'll talk about that a little bit. And it's curative a lot of times. But interestingly enough, the first case they did was a track athlete, and she was a sprinter, and it cured her colitis that she had, but she gained 80 pounds in the next year. So they went back and said, hey, who donated that stool that we used to cure her? And it was an obese female. So now you have to be normal weight to donate stool because it has such a huge impact. And then you want to maintain your gut diversity, and we'll talk a little bit about that. That may be somewhat controversial. What about the gut microbiome and obesity? We see this increased ratio of Firmicutes, which is like when you say, how can that person eat the same exact thing as I do and they don't gain weight, but I do? Firmicutes is really good at getting every drop of energy out for us, right? And so Bacteroides isn't as efficient. So if we change that ratio, we do better a lot of times. And so you want to have, and with obesity and diabetes, all these things are true. We have reduced diversity. We have fewer of different types of gut microbiome there. And also alteration of short-chain fatty acids. What's a short-chain fatty acid? Well, that helps us to have satiety, and it also maintains that gut lining. And then also we have an increase in inflammatory microbiome. So these guys are kind of rough. So if these guys walk in right now and we all kind of just say, you guys take over, you guys run the show. I was in El Salvador and these guys would run the show. But so this is what you would think about as the bad bacteria, like Clostridium difficile, like Dr. Vega's son maybe has a stomach bug that took over and made him sick. Well, what happens if all the good people rise up? If you have a big community and they say, yeah, it's not going to happen here, right? We're going to put you guys in jail and we're going to run the show. And we're going to have a little bit more peace. So that's how the gut microbiome works. So Clostridium difficile, which is what happens after antibiotics, it doesn't happen because that's all of a sudden introduced that bad bug in. What it did is get rid of all the good people that were supposed to keep us healthy. There's one called Bifidobacterium in particular. Dr. Sabine Hazen had a predictive model for the flu that said people with high Bifidobacterium wouldn't get really sick or they wouldn't get it. And she said, well, if it's true for that, like couples who had, if the husband had really high Bifidobacterium working out in the fields, for instance, and the wife was in the house with low levels, she was more likely to die of the flu. So on the cruise ship, so it's kind of cool to have a captain, but you don't need 35 captains, right? You need one or two to get us through, but we also need people who prepare the food. If you don't have the people who serve the food, the people preparing the food make no difference. So the gut microbiome is like a little society, and they all kind of work together. And the end product of one bacteria feeds the next one so that they can do their job. So what are some things that a lot of us have been on low-carb diets, but we're still struggling because we have an imbalance of the gut microbiome. So alcohol, processed food. So when we go keto and low carb, we're rocking. When we go keto and low carb, we see a huge difference because we took out all those bad things, right? All those processed food that were leaking through our gut. So we do see a benefit. Again, artificial sweeteners, a lot of those People are saying, well, I just drink my Diet Coke, there's no calories, so it's okay. All the studies show it doesn't work, so it does have some effect on insulin. But on this one, I'm just talking about the gut microbiome. It's been shown to decrease the diversity, increase inflammatory gut microbiome. And so some of these that a lot of us low-carb and keto people are using, they do better. Xylitol, allulose really seems to have a good effect on the gut microbiome also. So it's not just about the calories. And then, again, the carnivore diet, we see huge benefits. Sean Baker would put up all these things, and I think, man, how can he have so much benefit? But part of it is we took out all the bad stuff again. So you increase your Bacteroides, you decrease your Firmicutes, which is a good thing, right? So you're taking less energy out of your food when you change your diet. And also you have increased improved GI function. So a lot of people's eczema, autoimmune disease, all those things get better on a carnivore diet. But what are the possible downsides? These guys called Firmicutes, they also make short-chain fatty acids. That helps to feed the gut microbiome. And also gives you satiety, which Tro's talking about later. So if we have decreased microbiome, because if you're just eating meat, you're mostly going to have those microbiome. Does that mean it's a bad thing? We don't know in the long term. So these guys, like our cruise ship, they maintain the gut lining. So these are all really important. So Akkermansia is the one. Bill Davis, does anyone know Bill Davis? William Davis? Yeah, he's a cardiologist who wrote Wheat Belly. But he also wrote one called Super Gut, and I asked him in an interview, hey, are you concerned about anything with the carnivore diet? And he said, long term, I'm concerned about Akkermansia. I'm like, what the heck is that? So Akkermansia maintains the gut lining and increases the short-chain fatty acids. So does Bifidobacterium, which I talked about with the immune system. And so the importance of short-chain fatty acids, they go to the brain, help improve the gut-brain barrier, and also the liver, to decrease fatty liver disease. And we also make these, let's see, I get my pointer to work. Acetate, propionate, butyrate. So what we see on a ketogenic diet is that we're increasing butyrate. So butyrate is with ketones. They maintain that gut lining to keep us from getting leaky gut. But look at this. Those guys also have an effect on all the neurons in the brain, right? Leaky gut. About 5 years ago, I'd say, this is crazy talk. Leaky gut, what is that? So if we're talking about the tube, and you heard some of the experts talking about it, saying, hey, if you put a bunch of fiber in there, you're going to clog that tube. But what if you just have a little bit to keep that mucus layer going? And if you don't have the mucus layer, what happens? That gut gets leaky and things start leaking across the membranes. So up here, you can see that this should be all stuck together. We get breaks in that, right? And what leaks across? This thing called lipopolysaccharides. And they're pretty bad, and I'll show you some examples of that. Also, the blood-brain barrier gets affected when you have leaky gut. So lipopolysaccharides, what is that? It's part of the bacteria that it can leak across. It's super pro-inflammatory, can cause depression, anxiety. A lot of us are using a ketogenic diet to treat seizure disorder, major depression, bipolar disorder, schizophrenia. So what role do these guys play? Lipopolysaccharides, when they leak across, they actually did a study with like 18 men, and they injected them with a tiny amount of this lipopolysaccharide. All of a sudden they became depressed, anxious, crying within 3 hours, right? A tiny amount on a pinprick. So how much of an effect does that have leaking across all the time? So it has neurologic deficits, it causes inflammation in the brain. Part of this that we're doing with the ketogenic diet is trying to decrease inflammation. And so metabolic disturbances, lipid metabolism, sugar metabolism, all those things are affected by lipopolysaccharides. And even with stress, right, it causes a leak of those toxins across our gut. So, you have black belt material on me now, right? What happened? I went keto, and 6 weeks later, this is what happened. So of course my partner said, you're doing that crazy keto diet. It's doing something to you, right? So first it started with these little guys, hives everywhere. Anyone know Job? That's why I was kind of like Job for a year and a half. So that would happen. Then I would get a little Angelina Jolie look going before it was cool. But that was brutal. Anytime I had cheese, wine, almonds, so I'm like, I'm allergic to something on the keto diet. So ultimately what I did is I went to an allergist after about a year and a half, and he tested me for all food allergies. He said, you're not allergic to anything. I'm like, how can that possibly be? And he says, you know what? I think I have another idea of what's going on. Let's do patch testing. He goes, oh, you have a severe mold allergy. He goes, don't go home, don't go to work till you figure it out. So I called my tech guy at work and I go, hey, can you take a look in the attic above my office while I'm working 18 hours a day? And this is pink fiberglass, but it's now black fiberglass. And you can see all the rust on all this metal. So there was a leak going on for a long time, but it bothered me for about 2 years. I thought, why is it that I'm the one whose whole face is swelling up and other people might have sniffles or little things, but I'm getting this crazy, crazy stuff. So a year and a half later, I was looking at some keto stuff, and I realized I was listening to a talk, and he said, you know, when you think about parasites and dysbiosis, and the guy says, anyone with autoimmune disease, anyone with asthma, eczema, and he says, oh, and by the way, if they have a mold allergy, it's 1,000 times worse if they have a parasite. So I had just gotten back from Guatemala on a medical trip and got a GI bug, and so it turns out I had a parasite, treated it. I have no mold allergy now, so I can hang out with you guys without that. So other diseases linked to dysbiosis, inflammatory bowel disease, metabolic disorders is what we're trying to, yeah, I think we got something weird going on. Cardiovascular disease, allergies, and neurologic disorders, Parkinson's, dementia. All these things have to do with lipopolysaccharides. So I'm not saying, what I'm saying is, look, a ketogenic diet helps with these things for sure, because you're putting less toxins into your body. But is it possible that we can cause some other problems? So again, just showing you again. This will go. Obesity, we're looking at these increased bacteroides, increased firmicutes, and in obesity over here, this is normal. And again, we're looking at the gut lining. Again, short-chain fatty acids have to do with satiety a lot, and Tro's talking about satiety today. And you go, okay, these branched-chain fatty acids, short-chain fatty acids have to do with decreasing inflammation in the gut. All these things we're trying to do with a low-carb metabolic approach. The question is, why are we doing metabolic approach? We're trying to decrease inflammation, right? We're trying to take out the toxicity, and we're trying to prevent all these long-term complications. So this slide shocked me, because this thing, acromancy, that we never heard of, that was theoretical. I go, okay, that's a theoretical thing, but is it real? And so the metabolites from acromantia have to do with endotoxin reduction. So they block the lipopolysaccharides. They'll digest in your gut, and it goes out like 60 to 80% of your stool is these gut microbiome. So if it's absent, increased atherosclerosis risk, worsening of lipid metabolism, high sugars, high triglycerides, things like that. High lipids, because it decreases clearance if it's not there. And it restores those tight junctions. So if it's gone, more alcoholic steatohepatitis, fatty liver disease, a lot of us struggle with that. So you go, how much of a role is that? And again, this is particular to me, is that a lot of us, I've seen a lot of patients with oxalate sensitivity, excuse me, and high uric acid. So guess what? Look at the guys who digest those in the gut, so you pass it out without absorbing it, so you don't have to get rid of it from your bloodstream. This is this Oxalobacter, bifidobacterium, which I already talked about, lactobacillus. Guess what? Histamine sensitivity, same thing. Enterobacterium missing, decreased histamine degrading lactobacillus and bifidobacterium. Those two bugs being gone, we get a lot of those. So I have patients that come in, and when we fix their gut a little bit, they no longer have histamine sensitivity. It goes away. Not everyone, but a good majority of people do. Also, eczema gets better, asthma gets better. Lipopolysaccharides leaking across causes a lot of these things or makes it worse. And again, microbial, this is depression and anxiety. You can look at the microbiome and say this person's depressed, this person's anxious, or this person has Parkinson's. It's pretty wild what we can see just from what we're passing through. So again, we have increased inflammatory microbiome, decreased short-chain fatty acids again. So it's hard to get those short-chain fatty acids just through our diet. So we need those little bugs to be helping us. So the concern is, if we're missing some of those, some of us may struggle. Now, again, ketones do benefit us for sure. But is it enough? Is it enough to maintain our gut lining? And so, unveiling the crystal ball. So the crazy thing is, you can look at these stool studies, and they can predict this person has Parkinson's, this person's on the course to dementia, this person's obese, just looking at the stool. They're like fortune tellers. But how do we, like all this bad news, but how do we maintain it or how do we fix it? One, and this is the one over here that is the elephant in the room always, stress. Like stress is our #1 cause of falling off the wagon for sure. So stress, adequate sleep, they're key. So some people, sleep doesn't matter, sleep when you're dead. Well, the lack of sleep affects the gut microbiome and insulin sensitivity. Avoid unnecessary antibiotic use. Antibiotic use as a kid is an independent risk factor for obesity and diabetes. So by itself, it's like, why does that have any difference, right? Being breastfed versus bottle fed, you do better, right? C-section versus vaginal birth, huge differences. So consider probiotics, prebiotic, and we could talk a little bit more about that if they are necessary. Are they for everyone? No, but I think a lot of people who went carnivore didn't go that way just to lose weight. It's because they had a ton of gut problems going in, right? So they already probably had gut issues and it got better on carnivore, but is that sustainable long-term? And I'll show you some data and we could talk about it. Probiotic-rich foods, you hear people do fermented stuff. Avoiding the ultra-processed foods. So does leaky gut affect metabolic rate? Yes, there's good data on that. And if you think this always makes me feel reassured, because when I see Ben Bickman talking about it, he's talking about a study where they showed that obese kids had 2.5 times higher zonulin levels, which is a measure of leaky gut, than normal weight kids. So diet, stress, all these other factors play a role. So stress by itself can be an issue. And again, this gut microbiome, endotoxemia, and insulin resistance, so they're showing that if you have leaky gut, if you eat 0 carbs and you have leaky gut already, you're gonna have more insulin resistance. And that's a huge thing. That's what we don't want, is insulin resistance, having super high insulin levels. And then leaky gut and endothelial dysfunction. I just pulled a couple studies, but you can see all these studies that show leaky gut, high lipopolysaccharides leads to endothelial dysfunction, which is a precursor to hypertension, cardiovascular disease, and all these things. So this is from a practical standpoint. Some of you may have seen a GI map, and I have no financial interest in GI map, by the way, but it's a test I'm using a lot more these days. Because when I see someone struggling, this is kind of normal. You see most of these little arrows are on the green. Some of them are going to be off a little bit, not a big deal. And then down here you see this Bacteroides to Firmicutes. They're still at a good ratio. And these are just some of the other stuff. We could also look for parasites. We could also look for H. pylori, Clostridium difficile, all these bad bugs. But I'm really today just focusing on what I'm talking about with regard to the gut microbiome. So this is from an actual patient of mine it's interesting in itself. He's carnivore for 2 years. He comes to me and he's having a lot of gut issues. He took 2 doses, 2 pills of amoxicillin, and he ends up getting Clostridium difficile. I was like, that's crazy. I know seniors who've taken 30 courses of antibiotics that don't have this. Why was he predisposed? But all of his numbers are super low, especially this one Akkermansia we're talking about, Enterobacteria, lactobacillus is low, which has to do with, he was having histamine reactions too. And so on that side, on this side, this has to do with pancreatic function and liver function. But you can see his zonulin is off the scales. He has leaky gut, super bad leaky gut, and he was having symptoms that went with that. Here's another example, another patient. You're going to see very similar findings. And again, calprotectin, which is a measure of leaky gut, and zonulin are both elevated. And again, these commensals they're responsible for maintaining the gut lining, the gut mucus layer, are super low. And you go, well, that's not normal. So this is what convinced me when I saw this. These are those two patients. So you can see this is an older test, the way my EMR, I copied it right out. His LDL went from 227 to 99. Now we can argue, is LDL matter? Is it that important? But it depends on the setting. So if an LDL is in the setting of a high insulin and high A1C, it makes me way more nervous than if all those numbers look good. The other trick is, this guy's been carnivore for all these years. His triglycerides were kind of where I would think they should be. Usually carnivores will have a very low triglyceride and a high HDL cholesterol, the good cholesterol, which we like to see. So that's all good. But look at this. His insulin, after 2 years on a carnivore diet, is 17.3. It should be 2, right? A lot of people are arguing long-term carnivore raises sugar levels because the red blood cells live longer. There's no data on that. That's opinion. Dr. Paul Mason, who's brilliant, he may be right, but we don't have data. We don't have any controlled studies to show that. But nonetheless, with no dietary changes, just fixing his gut, his insulin level went from 17.3 to 6.4. This is in a matter of months. His A1C went from 5.6 to 5.1. So with a lower insulin, he had a better A1C, which is showing that he's more insulin sensitive now, right? With no dietary change, he's still carnivore. CRP, which is a measure of inflammation, independent risk factor for cardiovascular disease, went from 4.5 down to 1.42. Same thing for another carnivore patient of mine. Her triglycerides cut in half. Her LDL came down. And I'm not saying this is good or bad, this is what it did. But it may be because that inflammation in her gut, her LDL was going up as an immune response. This lipopolysaccharide is known to raise LDL also. So insulin cut in half. A1C went from 5.8 to 5.2. And she also has rheumatoid arthritis. But you can see that her inflammatory markers dropped dramatically. No dietary change, again. All she did is fix her gut by doing some of these things I'm talking about. Another patient, this guy's not carnivore, but he had leaky gut coming in. And interestingly enough, generally we're gonna see that LDL go up on a ketogenic diet, at least this is 3 months apart. It stayed pretty normal. And then it came down actually. His triglycerides cut in half, right? His insulin went from 25.7 to 5.5. Now he wasn't keto coming in, so we got him on, and this is probably gonna have, but that's a pretty dramatic drop in 3 months from 25 to 5. And his A1C got better too, so he got more insulin sensitive, right? Which is expected on a low-carb ketogenic diet, but his drop was pretty dramatic. And all the symptoms got better too from the leaky gut and histamine sensitivity, things like that. So the sex hormones is very interesting because we all know that when we go through puberty, our gut microbiome changes. When you get pregnant, gut microbiome, even in the cycles of menstrual cycles, the gut microbiome changes during that course if you're following it. I don't know who does that, but they do follow it. And also, the one that's crazy is right here, progesterone. So progesterone, butyrate, which we talked about in the gut line, the short-chain fatty acid, modulates progesterone synthesis. And progesterone modulates butyrate levels, right? So who would think that our hormone replacement, a lot of women who are here on hormone replacement, they said, when I went on progesterone, my cravings went away, I sleep better, and I'm not as stressed. But part of that is maybe they're fixing part of this leaky gut, possibly. And I have all the references down here if you want to go double checking on that. Natural supplements, these are things a lot of us know about. But chromium, cinnamon, berberine, all these things help, and a lot of them have action in the gut, actually, helping the gut layer of short-chain fatty acid production. This is an interesting one. I was making yogurt, and it says, click here and you can look at our research, and I started diving deeper into it. So they take women who are overweight, but the interesting thing is, it didn't work as well. They said the studies weren't done as well with kids, but non-obese people, it didn't work as well. So it looks like it's helping with insulin sensitivity. But all they did was add in a teaspoon of inulin. So inulin's a non-absorbable starch, right? Non-digestible starch. So we can't do anything with it. So you go, okay, we can't do anything with it. So what good is it? Well, it feeds the gut microbiome. They're able to make short-chain fatty acids. And they found that their appetite got better, where they weren't starving all the time. They weren't snacking as much. And just mixing that in helped with weight loss. 4 to 7% decrease, just adding that in. And you go, why? Well, it may be helping with satiety. And again, call to action. Here's what we do, right? Prioritize your gut health, because if you're doing 5 shots of tequila every night, even though it's low carb, it's not going to help your gut microbiome, right? It's not going to help your liver function and fatty liver. And then also looking for a gut-friendly diet. Like, eat stuff that's not going to be high in a lot of the artificial sweeteners. Now, I want to preface this too. I just want to be clear, since I can see keto chat here. So little things like sorbitol, like low dose is not a big deal. A lot of these are high dose, so if you're doing it 40 times a day, right? So most of these clinically don't make that big of a difference. But I can tell you, stress and sleep, we see so many people go, I'm doing a perfect ketogenic diet. I weigh myself 30 times a day and I'm not losing weight. But part of that's the stress that we put on ourselves. When we're stressed, we decrease the flow to the gut, right? So your body's saying, get some blood flow to the brain, get it to the muscles, but leave the gut alone. But then we don't digest as well, and we start getting issues that way. So these guys, right? Sean Baker Reese, Dr. Boz actually interviewed Sean, who I love. He's a great guy, right? And he recently went on a ketogenic diet because he had inflammation he couldn't get rid of. And so I was thinking, I wonder how much is the ketones could be helping the gut lining, but the ketones themselves are anti-inflammatory. So maybe that's why he kind of did that. Well, Paul Saladino really upset a lot of the carnivores because he started eating honey and he started eating fruits and vegetables. And they go, well, he wrote the book on this stuff, now he's changing course. But part of it, he did it because he was having mental health issues and a lot of inflammation, right? And I don't know, I haven't talked to these guys, but maybe he checked his gut microbiome and goes, uh-oh, I'm missing some of these things that are important. Possibly, I don't know. I'll bring him and Sean on a podcast and talk to him about it. This guy eats fruit sometimes, not very often, but if he grows it, he eats it. He talked about that. And this guy's just a beast. He can do whatever he wants. But part of it, maybe they're changing course a little bit, and it may have something to do with this. I'm not saying it does, but I'm saying it's possible that the gut could be playing a role. The only way we know is to really look. I think if you're on a ketogenic diet or a strict carnivore and you're not getting results, it might be worthwhile just checking. If you're low on short-chain fatty, because I talk to people here a lot, and a few people told me, yeah, I eat steaks all day and I don't get full. Well, part of that is the short-chain fatty acids go to your brain until you're full. So maybe you just add a little, like butter has butyrate in it. So that but they have beef and butter, maybe that's playing a role in satiety. Because if we don't get full, we keep eating. So hopefully I don't get thrown into the sharks, but luckily I checked, there's not a lot of sharks up here, so I'm not too worried about it. And again, thank you for your attention, and now you can say that you know your stuff. But I have a couple minutes, and I just want to talk about a couple studies that I saw that intrigued me. So Bob Marley, like they took these mice and they put half of these mice in Bob Marley land, stress-free, everything's nice, everything's good. They took these other mice and they put them in a stressful environment where cats are trying to kill them, everyone's chasing, there's lightning going off in the middle of the night, they're scared of everything, playing terrible, like they're playing Britney Spears music constantly. And so when they took these mice, they put them out for 6 weeks, they bring them back in, and they gave them this stuff that's known to cause colitis, right? And they give them a few drops of that, and guess what? All the stressed out mice got colitis. None of the Bob Marley mice got colitis. And they go, well, that's weird, I wonder why. And when they looked at their gut microbiome, they go, these guys have a rose garden over here, and these guys have a disaster weed garden in their gut. So they said, I wonder how much the microbiome plays a role. So they took the healthy gut microbiome out of these guys, and they put it into the sick mouse, and it got better. And then they took one of the sick mice, and they put its microbiome into the healthy one, and it got sick. And they said, So they took all the rest of the healthy ones, and they put them on antibiotics for 6 weeks. They brought them back, gave them the medicine, they all got colitis, right? And you go, it has to do with the mucus layer of the colon, has to do with their gut microbiome diversity. So I think all these things play a role, and these are things we just have to keep an open mind. The crazy stuff, talking to Dr. Sabine Hazen, is they take people who had colitis, they get them a gut microbiome transplant from their kid or someone they don't even know. And then they do questionnaires. And then months later, they ask you, hey, what do you crave now? And they go, it's so weird. I used to love donuts and cookies. Now I love sushi. And they go back and ask the person who donated the stool, hey, what do you eat when you snack? Sushi, right? It's crazy. And they also have done things with people with dementia who got a microbiome transplant for other reasons. It's not indicated to treat that. But all of a sudden they start remembering stuff. One patient could not give a history at all, so she asked the wife. And then 6 weeks later, after his gut microbiome transplant, she was asking the wife all the questions again, and the guy says, why are you asking her? Why don't you ask me? And he was able to give his history. So things like that we just don't understand. And it could be the anti-inflammatory effect on the brain and all these kind of things. So I think it's just important to keep an open mind and say, okay, let me check. If that's one thing I can look at to see if I'm not getting the results everyone else is getting, maybe it's because we have a bad gut or a different gut. So again, these things don't apply to everyone. There's tons of people, and I have tons of patients doing carnivore who are doing great. So I threw out the examples of people who really, I have 4 people in my practice who got C. diff colitis. They were all carnivores, and they were fine. And they took it for a sinus infection or whatever, and boom, they got C. diff. And that's unusual. So I don't know exactly why that is, but there's tons of people, again, who are on carnivore who do just fine. So I think it may depend on what our gut microbiome is coming into it, and then we just figure it out that way. So I think it's just listening to your body and doing what works for you. So thank you.